Hi, Paul here, and I'm here with John Morrison at the ISGE meeting in Opatija, Croatia. It's been a great meeting, John.
Absolutely
and
wonderful.
One of the highlights was the SLS surgical surprise session from the world team that you're part of. So any tips or tricks for the folks back home about avoiding injuries?
Well, with the surgical surprises, we concentrate on, even though they're rare injuries, the potentially lethal injuries, people don't come across very frequently, and so we want to stress, and we did stress, the importance of, first of all, recognizing them and how to manage them appropriately initially.
So the folks are there back home, they're doing their standard operation, and suddenly they think there may have been an injury to the bowel. What's the first thing they should do?
Well, first thing they should do is have a high index of suspicion. They should do everything in their power to make certain that it is not injured. That's the main thing. And then once they are certain of that, still maintain their high index of suspicion. Be watching for the signs, which we covered in our tips and tricks, to make certain that the patient doesn't have this injury.
What would the main signs be?
The patient should be getting better. Their pain should be going down. They should be improving. Their reduction in pain medicine should be appropriate for the procedure they had. If none of those things are happening, you should have a high index of suspicion, and is not something necessarily that's easy to diagnose with just X-ray. It's a clinical diagnosis, and that's probably the most important.
What sort of signs would you look for, and when would
Increasing abdominal pain. If you have an early injury, it'll be within 24 hours. If it's an injury secondary to energy use, you're looking at 5 days or more. That particularly is a very tough time to make these diagnoses. But again, it's the high index of suspicion that is so key.
We wish everybody could have been here. It was a great meeting. We'll have another one next year, I suppose, so I encourage all of you to get involved. And we'll have other SLS World Team tips and tricks at other meetings around the world, and of course at MIS Week at the end of August, beginning of September. Thanks, John.
Thank you, Paul.